We are confronted primarily with a moral issue. The heart of the question is whether we are going to treat our fellow Americans as we want to be treated.
Doc, my legs are hurting, my eyes are going blind.
We're all family out here.
Family out here.
We try to take care of each other and help
That's
each
right.
other, you know.
Yeah.
Nobody else gonna do it.
Yeah.
People don't want to really see what's really going on. They got a blind eye to it.
When you need medical attention, you get to go to see a doctor, and the doctor will decide whatever treatment is necessary, and either he takes care of you or you go to the hospital. Then, when you recover, you get to go home. Well, it's not easy for people that live in shelters or live on the streets, as I do. And becoming homeless, it can happen to anybody. You never could have told me when I graduated from college that I'd end up at the age of 56 living on the street like a stray cat. Surely you can help me. You see, I'm only 32.
We are here to make sure that men, women, and children who become homeless in Boston have access to the same good quality health care as you and I have. And they get it with dignity, and they get it in a system that has some of the highest quality medicine that America has to offer.
At Boston Healthcare for the Homeless, we provide services at over 80 different sites, and we see over 11,000 patients a year. We see our patients on street corners, we see them in shelters, we see them in day programs. We believe in a multidisciplinary approach so that a patient gets to know a nurse, an MD, a case manager, a psychiatrist, and they hand in hand see patients together so that they can address both their behavioral health needs and their medical needs.
We've been in our new building, and it's just wonderful to be here. It is so bright and so spacious. Our patients are able to come by subway or by bus, and also by foot. Most of them actually come by foot. We have clinics in several of the hospitals, at Mass General, at Boston Medical Center. We have an HIV team, a transgender clinic. We also have a pharmacy, a dental clinic. And the other great advantage is that it's across the street from the emergency room at Boston Medical Center. In addition to all of our outreach sites, we also have a 104-bed respite program that provides 24-hour medical care for homeless men and women who are too sick to stay in the shelter, but not sick enough for the hospital.
Patients who come here have a medical illness requiring a period of recuperation and treatment, and they are independent in their abilities to take care of themselves in terms of dressing, bathing, transferring from a bed to a chair.
Homeless individuals often have competing priorities, so if they have a medical need, they're not able to address it until it becomes more severe or an acute state.
I'm here at Barbara McInnis because they found a mass in my lung.
I'm sick. I have pneumonia.
I broke my ankle.
I have neuropathy.
Pancreatitis.
Broken jaw. Brain surgery.
Alcoholism. AIDS.
If you're homeless, then the Barbara McInnis House is a wonderful place to recover, get 3 really good meals a day, and lots of activities to keep you occupied, and reflect and think about what the next steps might be.
I just want to be sober and in my own apartment eventually, but I probably do have to go through a treatment center again to get that far.
I'm just sick and tired of being sick and tired.
We also have a street team that provides primary care to homeless men and women who, for whatever reason, won't come into shelter.
At nighttime, when everyone else goes to bed, that's when you can tell who's been staying out on the streets, and it's probably the most opportune time to come out and take care of people who are really street folks. Our first goal back in the mid-1980s was to get out of the hospital and get our clinicians out to the places where homeless people would be, because we found that if we didn't get to them, by the time they got to us, it was too late.
Things happen. I've been out here 38 years. This is my dog for a long time.
As they begin to trust us, they will come to see us in the clinics. And over time, everybody gets to know who you are. So they're coming to see the individual. So we're learning that That has really helped with continuity. And the McInnis house has been basically our salvation. So when somebody here is really sick or getting sick but won't go to the hospital, afraid of the emergency room, most of them are very comfortable about coming over to McInnis house. I think it's a place where they can feel comfortable, don't feel pressured, not judged, and we can deliver some pretty good care while they're there.
Initially, I came in with a broken foot.
I had congestive heart failure.
Pain management.
Diabetes. I broke my shoulder.
I got a pain in my heart, and I'm slowly losing my mind. It'd be nice if it was $1 million.
Still pregnant. Mrs. T was admitted yesterday. She's 24 years old.
Today is September 3rd, my birthday.
She's about 8.5 months pregnant.
I had put myself and my child through, the addiction of crack.
And has finally been clean from drugs for the last 3 months.
My mother was also a drug addict.
A week ago, she found out that this baby has what's called hypoplastic left ventricle, which is a very severe heart defect that would result in death were it not for an urgent surgery right at the time of delivery.
They had to stop my labor 13 times because of the fact of the drugs getting into my system.
And it's very important for her to be near the hospital.
He's still kicking, still moving.
And yet the halfway house where she's been staying is a couple hours away.
I'm probably gonna have him in any time now.
Hey, how you doing today?
My name is Jorge Morgan. I'm going for dialysis 3 times a week for 4 hours a day.
Jorge's kidney failure is a life or death situation at this point.
I don't have no place to go.
Transplant is the hope, and what we can do is offer you treatment for your infection that's affected your kidneys.
They found out that I had a very large kidney stone. And then I came in for my surgery, and I had a mark on my ear, and it came back that it was skin cancer. I've been here for about 2.5 months. There's a lot of hospitals that if you're a heroin addict, from the streets, that you're not important, and sorry that I'm emotional because I never thought that I was worth caring for.
How we take care of individuals who are the most vulnerable among our society really says to us as a society, what values have we chosen? So one of the reasons I like working here is because this is a group of people who said it's important to take care of people who've fallen down. And it doesn't matter what the reason is they've fallen down, but they've fallen down and they need their help, and we'd hope that somebody would do the same for us if we were in that case.
This is where we've been trying to find one of our very favorite patients who for years lived right up here. It's just who we're looking for. Keisha was very much a part of the streets just over 5 years ago and going back about 10 or 15 years. And she would back then occasionally come into our old McInnis house. I wasn't sure who it was. I didn't want to wake you up. I'm sorry. Hi, Keisha. Keisha, we want to get you in. But she was struggling with lots of very terrible medical problems that she was really struggling to cope with.
Jim,
No, okay. Why don't you, Keisha, I don't know, for some reason I don't feel it's safe out here. It needs to be safe.
Yeah, you know what?
Why don't you do it? Will you come in? Will you do that? She wants to come in.
Hi, we're here with Keisha Wilkinson, and
Today we knew we had a bed that was free, and when we woke her up, I wasn't sure what she'd say. Initially she said no, but I think she saw Eileen, she saw Jill, and felt really comfortable, and I think was able to say, okay, I'm ready to come in.
Morning.
I'm gonna guess 5 or 6 years. She stayed clean and sober, got housing, and was living in one of the suburbs and doing really well. Came to Washington, D.C. with us and was a spokesperson. She was on a panel at the National Conference on Homelessness. Incredibly articulate, just a wonderful and caring kind of human being. She relapsed about 4 months ago and has been back living outside. So today, thankfully, she came back in, and we'll see how she does now.
What I love about McInnis House, what I love about the staff, once someone's admitted, they're so welcomed here that patients immediately sort of become disarmed and feel very comfortable. Because we're able to build these relationships, oftentimes we can kind of chip away at some of the fundamental issues that patients are coming in for. What's the underlying issues around their hypertension, or what's the underlying issues around their homelessness? And because of that, I think ultimately we do improve the quality of life for people. And I always have felt that that's what McInnis House is. It's respite from the streets, it's respite from the shelters, it's respite from your medical issues, from your substance use issues, and it's a chance for people to be able to become whole again.
Just give me a shot of anything to take away these blues.
Oh my God. Keisha came into McInnis House and did actually really well for a couple days when we last saw her. Hi, how are you?
I'm Jimmy.
You're Jimmy. Hey, I'm Jim.
Jimmy. Are you a doctor?
I'm Jim O'Connell. Yeah, I'm a doctor.
O'Connell?
Right? Yeah.
A good Irishman.
Oh my God. You left McInnis House. Look at this face. Something went on and she decided it was not her time to stay there, so she left, much to our chagrin, and came right back to staying in her place down under the Longfellow Bridge with some of her friends down there. So tell me what's up. What happened?
I went out and got drunk. I fell 20 feet. My nose is broken in 2 places. I have 15 stitches in my forehead. And I'm not the same anymore.
And what are you gonna do tonight?
I'm gonna go to sleep. And I'm gonna meet Jill in the morning.
And what do you hope to do?
McInnis, I'm done. I can't do this.
So we're gonna hope that she comes in tomorrow. She's gonna go see Jill at Mass General in the clinic there, and if there's a bed ready, we'll bring her right over to McInnis House. But on the streets, we've learned to, we're gonna keep our fingers crossed. What she wants to do now may not be necessarily what she feels like doing in the morning.
McInnis House has got a bed waiting for you.
You made it back, huh? Yeah? How are you feeling today?
Tired. I want to get sober. I want a life of my own. I want to be me again.
I think you learn very quickly when you start working here that if a patient falls down, we're there to pick them up. They fall down again, we'll pick them up again. And nobody ever loses hope because we never know when it's going to be the time that someone is going to get the strength inside of themselves to make the changes needed in their lives.
Mark has had a really successful stay here. He's leaving today after having had his skin lesions biopsied and treated.
Mark, that is awesome news. I am so happy for you.
Thank you, I appreciate it.
He was also diagnosed with hepatitis C, and we were able to connect him to the specialty care that he'll need to have that treated. And the biggest success, I think, is that he's headed to a treatment program.
Thanks to the McInnis House, I will make it.
Kiana had her baby about a month ago, and we haven't heard from her since. And we really don't know anything about what's happened since the delivery, which we're told was successful. Jorge is still with us and continues to get dialysis here, and he'll be with us as long as he needs to be. I'm optimistic that we can help him get on a list for transplant.
Hey, good luck. Take care of that.
Bless you.
See you later. All right.
Thank you, doctor. Thank you, guys.
What you start to realize is that you get attached to the people. It's the stories that kind of grab you. And then pretty soon, and Keisha's a perfect example, pretty soon you start to see someone who would have looked on the surface as you walk by as just somebody who's doing too many drugs or a bum outside, and all of a sudden you see the person behind it. And you start to realize that the struggle they have is actually one that would probably break you or me, and that they've somehow been able to cope with that, and that's what they continue to struggle with. And I think it's the stories and the relationships and that sort of keep us involved.
Without McInnis House, this wouldn't be possible for me. I'd still be on the streets. I'd probably be dead by now.
You can get off your feet the care that you need. And hey, baby, you can turn your life around to bottom.
Yeah. American way.
Say it.
It's American way.
Doc, my legs are hurting, my eyes are going blind. I got a pain in my heart, and I'm slowly losing my mind. surely you can help me. You see, I'm only 32. Just give me a shot of anything to take away these blues.